Welcome to the Business of Race podcast, where we examine issues of race and racism, the impact it has on business, and what corporations and organizations can do to effectively address those issues while creating a better workplace for everyone. I am your host, Regina Newkirk-Rucci, the Director of Equity for 90 Forward. And today in the conference room, I'm so delighted, and it is a treat. We have Dr. Atiya Abdelmalik, who is the director of the Urban Health Alliance's Center for Health Equity and Social Justice, and just a wealth of wisdom, one of my favorite people to talk to, right? And we also have the illustrious Dr. Kimberly Allen with us, who is the CEO of 90 Forward. Welcome to the conference room, ladies.
Thank you.
All right. So we're going to just jump right in and get down to business. The agenda topic for today is organizations addressing and why they should address the social determinants of health. Now, I think this is something that doesn't often get talked about. We talk about it in our circles, but I think if you are the average director, manager, C-suite executive, you're probably not even talking about or discussing the social determinants of health, much less why you should, as an organization, be addressing them. So let's just start off with some general education, make sure we have shared vocabulary. What are the social determinants of health?
You know, if you think about all the factors that determines a person's life, their lifestyle, from social and economic mobility to education level to access to basic needs such as food, adequate transportation, financial security, housing, the roof over my head, all the social needs in order for us to live a high quality of life and well-being outside of access to health care. What are those other basic needs that I need to have in order to flourish?
And those things also have a direct impact on your health care and your health, right?
It has a higher impact on it. You think about it, you can go get a prescription, but if you can't fill it, you don't have the financial means to fill it. You can be told, I need you to eat more fruits and vegetables, but you live in a food desert. You don't even have the financial means to even buy higher quality food. They can't be disconnected. And we have been disconnecting those social needs from healthcare needs for far too long.
Okay. And before we delve into the social determinants of health, also just want to take a moment, this is a podcast where we're talking about issues of race, and we have a tremendous number of racial health disparities, right? So if we're having poorer outcomes for people of color in particular areas, then these social determinants of health are going to have a greater weight. So what are some of those health disparities that employers should also be aware of before we even get into these areas of addressing?
Yeah, I think that whether or not they're calling them social determinants of health or they're even acknowledging they exist, they're talking about it. Employees with, high blood pressure, diabetes, folks who are trying to take care of their mental health and stability. All of those things come into play, and really just, dental hygiene, right? Skin care, all of those things are impacted by the environments in which we live. And we may not attribute it to those environments because of our, intellectual, level, because social determinants of health is sort of a higher level of higher order of thinking, but and we may attribute it just to, you don't go to the doctor, you don't go to the dentist, but why don't you?
That part.
Is it that you don't have transportation? Is there not a dentist close by? Do you even have access to the insurance, or you have the insurance through your employer, but there's no one to care for you around, or no one to remind you and say, you have to go do this thing every year or every 6 months to go and check on your teeth. And so those are some of the things that show up in the workspace that employees that sometimes sort of fall out on the job, unfortunately, because of untreated, health concerns.
All right. And so, just off the top, because I don't think it's hard for employers to grasp why health is important for them and their employees, right? From the fact that employees with poor health are going to be poor performers at work. They're going to have higher absenteeism, right? And they're even less likely to stay with you because they're having to deal with their health concerns. On the flip side of that, for employers is also the fact that the unhealthier your workforce, the higher your insurance premiums are that you're having to pay as well, and which then may even affect the coverage that you're able to provide for your employees, right? So there are lots of bottom line, real financial costs to employers in looking at health. But I think a lot of times employers really focus on either the insurance components of it or the specific health things, right? So maybe you're going to have a diabetes seminar, or you're going to have blood pressure screenings and these things. But these social determinants of health, right? So housing, food insecurity, poverty in general, transportation, childcare, these things that are really impacting health outcomes, they're driving health outcomes in a lot of ways. What should employees, why should that be of concern? I'm like, that's just the world. That's just the way things are. That's just how life is. That's just life. So why should that be on an employer's agenda?
You mentioned all of these intersections with an employee. We had this old way of thinking that you leave your personal life at the door. That was an old way of thinking. We know that when an employee shows up at the door, they're showing up with their full selves. They may not show it. They may come in with a mask on, but they're coming in with issues with caregiving responsibilities. They're coming in with issues of health, mental health, the surge in mental health issues. They're coming in with the trauma of being faced with racism in the places where they live, work, play, worship, to covert and overt racism in the workplace. They're bringing all of this weight into that company. When you talked about absenteeism and presenteeism and productivity and it truly impacting the bottom line, not only that, you got to look at the life cycle of, if those are my issues, if a employee has diabetes and they got good insurance, they're getting health care, but if they have diabetes and they're also impacted by social needs, housing instability, financial strain, violence in the home and in the community, that just compounds all of the issues that they're bringing in. If we truly value the greatest resource, an employee, then we would truly value all of the intersections of their lives. If we want to maintain our workforce, we're thinking about, when you think about the great breakup and the great resignation, we don't really want that to impact, knowing that it's going to cost us more to hire and onboard new employees. Then I'm going to be concerned about all of these other issues. But it comes down to, what does an employer value and who are they accountable to? We can be accountable to shareholders and board of directors, but also be accountable to the communities where our companies sit in and reside, as well as the employees that create the financial rewards that company reaps.
So, and I think about this because when you mentioned the issue of accountability, I immediately went to shareholders, right? But it's hard for me to draw a line from our profits are down because you weren't addressing childcare needs in your employees. Even though if you had, maybe you wouldn't have had the absentee rate maybe you would have had higher productivity. Maybe you wouldn't have had 3 people quit because they couldn't afford the childcare or they didn't have anybody to watch their baby because grandma can't do it anymore. It's harder to draw those straight, very crisp lines to social determinants of health, even though we know they have this tremendous outcome. I mean, it's 80% of actual health disparities and health issues are impacted by social determinants of health, whereas opposed to 20% actually impacted by clinical care, right? We all know that stress is one of the huge drivers of all health issues. And all of these things that you're talking about create stress. But it's hard for me to say that was the thing that did it. So how do you help employers make the business case for it? And how do you hold them accountable when it's hard to say that was the thing that we needed when it's all of these things?
I am a big fan of data. So I think if you don't collect it, then start collecting it. But before you even do that, there are a lot of case studies in other companies who are doing similar things to improve retention and productivity and all of those things. And they can point to the profits, too, that they're reaping because they've done a little bit of the homework for you. So you don't have to go out and reinvent the wheel. But is there an exit interview that's saying this person quit because we couldn't let her off because she needed childcare? Are you asking those kinds of questions? Are you recording those kinds of things, or do you not want to record them because you don't want to look like a bad boss or a bad people manager or insensitive? Because, right, the other side of documentation is that sometimes documentation gets out in the public, right? And so people will start to say, oh, they don't support women with children over there, right? And they don't want that headline. But my argument is, then how are you going to fix something if you don't know consistently that this is an issue? And so if transportation is a big issue for your employees, and folks are not showing up on time because the bus is late, or it takes them 2 hours or a 3-hour commute to get there, and because they show up, 30 minutes late, like you're having their head on a stake, like what's another sort of course of action that you can take to help them get there on time? Now, I'm not saying you go out and buy all your employees' cars, right? Is there a different shift? Are there bus passes? Are there things that you can do? Is there an Uber partnership, right? Like Uber partners with everybody, right? Are there different partnerships and things that you can leverage to help mitigate those circumstances that will improve people staying versus sort of penalizing people? We just talked about this, penalizing people for poverty, penalizing people for having life happen to them, or penalizing people for doing the best they can with what they have. I can't live on the south side. My job might be there. I can't afford to live over there. So I got to go live, on the other side of town. But I also don't have a car. But this is where the job is, right?
So even when we think about how do you connect the dots, they have data to connect the dots. Now you add to that data. So companies for quite some time have conducted health and well-being assessments, right? Whether it's through the company, whether it's through a third-party vendor, whether it's through the health insurance, they will show you the health and well-being of your employee population. So we collect data on all of these health indicators. There are companies now that are adding a social determinants of health assessment to go along with the health risk assessment or the health and well-being assessment. The other thing is we don't do simple things like have conversations with our employees. We survey our employees to death about the culture of the organization. You can also ask them about their quality of life. There are other means of gathering data so that you can begin to connect the dots, not just from a health standpoint, but also from a social determinants of health standpoint. You can look at your benefits. You have power as an employer to work with your insurance companies to determine, are these benefit structures affordable for my employees? How about the cost sharing? Can you do more of that? What are the actual benefits that are being offered? We think about tuition reimbursement. Well, there are organizations that are paying up to $60,000 for student loan repayment. Can you imagine that? Having that? But you can structure benefits, whether it's childcare, transportation, loan, housing loans, housing down payment assistance. Companies are structuring full benefit packages by first understanding what's needed by the population that they employ. You know where employees live. Are those communities, do they have access to safe and affordable housing? Do they have access to a built environment that allows them to feel safe in their community? There's so much data employers are sitting on that they can structure an entire program if they value helping employees reach their highest level of living.
Well, and I think something else that has to happen that is oftentimes challenging for employers is this issue of equality versus equity. And corporations love to stay in the equality space because it feels safer, right? If I give everybody the same 3 benefits, then I'm not going to get sued. And I do recognize that you need to protect yourself. I'm not, negating that aspect of it. However, for instance, you may really struggle with childcare because you have 3 children. I don't have any children, so that's not my issue, but transportation is my challenge. And maybe even thinking about benefits as a pool. And you have this pool, you have maybe this much money allocated to you in benefits. And if you need to dip in for the childcare aspect, you can get that. Whereas if I need food insecurity is one of my challenges, then I can get assistance there, right? Or if housing is really a problem, then I can get the assistance and I can create my own package because social determinants of health are not equally applied to everyone. And I think that another challenge that we also have is that we really identified that as an income area. And I remember there was a employee who was very well high up in the company who I learned was struggling with food, but I didn't know that she was, her husband had lost his job. They were trying to recover from an accident where they owed hundreds of thousands of dollars. And they had taken in her father, who was also not doing well, right? You don't know everybody's backstory. So just because you're making a nice $55,000 salary does not mean that you don't have to worry about any of the social determinants of health. So how do we get employers to get past some of those hurdles? I think the hurdle of tradition of how we've always done it, making sure that how do I individualize it? Because that sounds like a whole lot of work. And, I don't want Susie complaining about the fact that she got XYZ and so-and-so got ABC. And recognizing that social determinants of health can impact you regardless of where you are in the organization, how much money you're making. It's not those types of factors that are necessarily drivers of that. How do we get employers to really tackle and wrestle with all of those things?
That's a great point. I think you mentioned the different needs and that it's not giving everybody the same thing. but it's really addressing the needs of those individual employees and families that are being impacted. There are some companies that are also offering different types of banks, a time bank, because I don't have school-age kids, but Dr. Allen does. And she may need time to take them to, providers, healthcare providers. She may need time to go to an assembly. But the time banks can be used for different purposes. So you can set up criteria to actually follow these guidelines. There are employees who are offering financial assistance, and the criteria is broad. So I may not need financial assistance for my prescriptions. I may need financial assistance for transportation. And so there are ways to address the individual needs and do it confidentially. So I'm like, well, how did Regina get this? Employers are doing that. They're figuring out, one, I can't give them all the same. Two, there are things that I can offer outside of a structure, like a benefit structure. And you would be surprised to believe the humanity that exists in companies. There are employees who contribute to these types of banks and supportive services. They may even donate their time off or contribute financially to certain, employee assistance programs. So it's really about putting together criteria or setting up different opportunities to address different needs, because we know we can't give the same thing. I go back to, what do you value? How do you demonstrate your care for your employees? It does take a little extra, but it's worth it.
Yeah, I could not have said that better. It is what you value. A lot of corporations now, and have been for some time, have been doing work like this in the community. They've been funding organizations and nonprofits to address social determinants of health. They've been funding organizations that do food security work. They've been funding organizations that do housing work. Sometimes forgetting that their employees are part of those larger communities. And so this is what I would consider classic corporate social responsibility, where you're taking the things that you would do in a broader community and apply them internally to make sure that your staff is also whole. And because of the partnerships you've developed in the community, saying to employees, these resources are also available to you. And you're right, it doesn't have to be a part of your benefits package. Here is our resource page. Here is where you can go. Here's who you can call. Here's where you can get those needs met, because we want you to be whole. And to your point, employees are also generous. The folks know their limits. I don't have to know who. I don't have to know why, but I'm going to give, because I know that there are here within our team, there are folks who have life happen, because life happens to all of us, right? And here's a place you can go to get some help from your teammates.
So I'm gonna put you all on the spot a little bit, but I want to talk about some of the particular social determinants of health, and I want to put some ideas and solutions out there. And I want to do it in two categories, because I think, again, this is a bottom line number, right? We can talk about how many days are lost because of poor health outcomes and how that impacts the bottom line. I don't think that's a sell that we have to make. But I also know that coming out of COVID, we're in the great resignation. I'm already struggling as a business, and I don't have the financial capacity or bandwidth to do some of these things. But everything doesn't have a cost. Some of it just has a determination. So I want to really talk about some of the bigger issues as far as social determinants of health, because there are quite a few, but addressing some of the bigger ones. And then what are some things that employers can do to help employees address those things, right? Okay, so one of the big ones is childcare. I'm still flummoxed at how much it cost to have somebody watch my child for 8 hours, right? That's a big burden on people, and especially for people who may have non-traditional jobs where the hours are odd, for lower income earners, and then just having somebody who's quality. I want somebody who's good, who's going to watch my child. Okay. So let's talk about the money category, because the money category is easy. What are some things that employers can do to help employees address issues of childcare?
I think number one, assess what you're paying your employees. I mean, let's go to the source, because you can give me a childcare subsidy. You can have reduced childcare in-house. There are employers that offer subsidized childcare. You bring them to work and you have no worries. You leave work and you're taking your child with you. That's all great. But we really want to shift what's happening from a social determinants of health standpoint, we need to assess pay equity. We need to assess what are we actually paying our employees, and is it enough for them to address each of those areas of the social determinants, including affordable childcare. They're doing something now in Florida, I want to say the St. Petersburg area, where companies are engaged in the community and identifying what's needed in a community to address social determinants. And childcare was one. Affordable, safe, quality, affordable childcare. And how can employers also partner with childcare organizations, right? Childcare facilities. Some of them are creating partnerships so that they have a safe, affordable, quality childcare in the community for their employees to use. So I think starting at the top is, what are you paying your employees? Mm-hmm. Because if they can't afford childcare, there's some other things I guarantee you that they're struggling with being able to afford. So how do we do that? How do we assess opportunities that were given to employees for advancement so that I can ascend to a higher paying job? You know, what is it that we need? We leadership development, especially Black women, to death. But then we don't give them the opportunities to actually take all of the leadership development opportunities you've given them and truly move them up in a space where they can earn a higher wage, a higher salary. We got to address those things. It's not, when you talk about equity, you need to start with, what does my organization look like? What does the leadership teams look like in my organization? What's our advancement opportunities? Where are we promoting? Where are we hiring? Do that first. Do an internal assessment first, and then you'll be able to address these other issues.
And I'm going to say that that's true for all of the social determinants of health.
That part.
Right? I mean, that's one of the issues. Pay equity, and not just pay equity, because I think obviously we start talking about gender gaps and racial gaps, that gets to the equity, but it's also really having a livable wage.
That's it.
Not a survivable wage, but an actual livable one. You know, I remember when Jeffrey Canada was talking about the fact that he had ballet at his school, and some of the funders were asking, well, why do the kids need ballet? He was like, why do your kids need ballet? Right? We want the same quality of life for everyone. We want you to be able to live and live well. Do you have the wages to sustain that? Now, I'm not talking about, go buy yacht money, but do you have the ability to do the things that provide you a high quality of life?
And I'll say, call me crazy, but I would love to be able to ascend to the level where we're talking about yacht money too, right? We talk about the floor a lot, and I think that's, we got to raise the floor, but I don't want to stop there, right? I want to ascend, put me in the C-suite, right? I got that ability. Talk about leadership development, like you've developed me, let me go develop so I can be talking about yachts. And that's, obviously being facetious, but if I think about, where you live, where you play, where you work, right? There are characteristics of your community. And I'm saying for us because I think we are all comfortable. And we also know that there are folks who would kill to have what we consider as just a way of life, but to have the luxuries that we have. And so why do we fault folks for wanting that? Or why do we think that there are some people who should be comfortable living at the bottom? We should be doing what we can to ensure that everybody has the opportunity, right? An uninhibited opportunity, not the false opportunity that we sometimes present to folks, and give people permission to dream. And I think when we are, how many employers ask their employees, how many of you have multiple jobs? Because that's an indicator that I don't have enough to make my ends meet. How many know that information? We were talking about childcare, and I said to you, childcare is half my mortgage. Why? Right? High quality, but also knowing that folks who are frontline workers in particular, they're not going to pay that. They're going to send their babies to Big Mama, love Big Mama, right? But then we start talking about educational gaps, word gaps, and we start losing generations. And so this issue is not all on employers for sure, but what can you do to mitigate that? And if it is raising your floor, so if your folks ain't having to work multiple jobs, or if it's having that childcare on site, if it's having extended hours, if it's a voucher, whatever it is, however you decide to do it, you got to do it.
Well, and I also think, there was a lot of hesitation before 2020 about flexible work structures. I heard it. Do we know if people are really working? Well, then we were forced to work at home. And then we found out, hey, people still actually work, shockingly enough.
More productive.
Right? More productive at work. So I also think there's also really looking at the flexibility and maybe thinking about positions differently. And again, this goes back to what's going on with each individual employee, and really trying to work with them to create a solution that makes sense for them, that also makes sense for the company. All right. I'm going to do one more because I do really still want to talk about sort of the big things and the little things, the costly things and the free things that people can do. So transportation tends to be another one that we see, right? And we're in the South. I greatly lamented moving back to the South for the transportation aspect of it. When I was in New York and DC, I didn't have a car. I hop on the bus, I hop on the train, I get wherever I want to go. Good luck doing that in Florida, right? And so how do you address transportation challenges for employees when, especially in places where public transportation is not as frequent or dependable as it is in, for instance, northern cities?
You mentioned one of them, and that's the flexible work from home or hybrid options. that takes so much. You talking about transportation, that hits a lot. It hits transportation, it hits food, it hits so many other different factors. Childcare, now I'm not saying that I want to be home with a child, but some companies are actually helping to reimburse for in-home childcare options and allowing you to work from home. So that's one area. Another way of addressing it, we talked about the vouchers, the Uber credits, rideshare, carpool. I remember a company I worked for many years ago, you could sign up to carpool with your employees. Some things that we don't talk about, because one thing we didn't touch on is, okay, we're talking about social determinants, but what's an employer's role when it comes to political determinants? Then we can address all these other issues, right? So, but how many conversations does an employee have with a transportation authority? How can we partner to meet the needs of my employees? This is where they need to go. What are the bus routes? Are there bus routes that aren't missing that we can add? But I think we need to look at this as this cross-sector approach to the addressing the issues that employers are facing.
That's right. I mean, partnering. I don't think you get around partnering because I believe it's Amazon here who has their own sort of like line of transportation, and I think it's in partnership with JTA, and maybe I shouldn't say names, but there's a company here who partners with our transportation authority to have a specific route for their employees to come in. And so maybe if, to your point, there is a cluster of employees in this area, there is a bus dedicated to those employees getting here. And getting here on time, and this is how frequently it needs to run. It might be twice a day, it might be 3 times a day, what have you. And I think that's a fantastic partnership. I think one of the things that corporations sort of miss, I almost wish that they took a note from nonprofits on this, and this is the idea of partnerships. We can't do any of these things alone. And again, the employer can't solve all of these issues, nor should they try. But how can you partner and work with people who this is their expertise, and they're going to help you figure it out?
And lots of times that partnership becomes really effective through a conversation, right? We had an employer who okay, we've got this huge childcare issue. They wound up having a conversation with the Y. The Y was having a huge space issue. Hey, we got space. You got childcare? We got space. Right there, we've got a facility for you. You provide us reduced rates. We don't charge you rent. You provide this for our employees, right? And you can get outside people. It was a win-win for both organizations, but you kind of have to have those conversations because a need you have, somebody else may be able to easily fill with an excess that you have that you are easily able to give. So, but that also starts with conversation. So getting out, talking to those organizations that can do that. You all mentioned it before, and I think it really deserves being mentioned again, is the employees themselves, right? So having time banks, I know that's done in school systems a lot, where you donate time for teachers who are on extended sick leave. Having giving campaigns, right, that you're going to be able to provide any kind of fund, emergency relief funds, or et cetera. There's some organizations have done food pantries. Employees bring food in, right? And you can even make specific requests of what types of food. Don't just get those dusty cans that nobody ever uses of corn and green beans. But, these are the things that are needed specifically. I think there's a wealth of ideas and using the employees or engaging with employees to come up with some of the solutions. That's a wonderful way to not only get information from employees, but to have employees be really invested in the process. And then again, you're investing in the company, that's going to improve retention. That's going to improve those relationships. All right. So getting down to the bottom line, we are going to give employers the big takeaway from this conversation. You had one thing. You said, if you didn't hear anything else, want to make sure you heard this. What would you say the big takeaway from today's conversation is?
Well, you said it, and that is listen. Listen to the employees. I think with any engagement strategy, we have to do a better job of asking the right questions, listening, but also being prepared to do something about it. One thing I am not a fan of, and that is questionnaires and surveys that do not materialize into something tangible, actionable, and produces some type of outcome for the people you are trying to impact. They do have the solutions. They can tell you what they need, and they can probably tell you several other partners or ways to support them. But they're tired of being asked without something happening. So I would encourage employers to do some internal work first, do a landscape assessment first of their organization, but also in the communities that their employees reside and the community that the employer sits in. Do that work first. Think about what can we do. If we ask this question, you need to be prepared to answer it or to provide a resource, right? So there's more work that needs to be done internally before you start engaging and making promises or asking questions you cannot answer.
And I'll say after you've listened with intention, then you partner. Don't try and solve these issues by yourself. Partner with organizations who regularly fill in social determinants of health gaps to help meet your employees' needs.
And I think I would add to that, not being limited by what is traditionally done, right? This is taking employers into some different spaces. And maybe that's a weird space and is this really what we do? I think being willing to look at those non-traditional ways that employers can intervene, as well as being open to creative solutions and not having a one solution fits all, but having a veritable approach for individual employee needs and being open about that, being very honest. I think people get that we don't all have to have the same box as long as every box gets the needs of the people that are being provided to. So I think that's some really great advice for employers. I hope that employers really take a bigger look at this. I think it is a tremendous topic that has such a significant impact, and it really has not been in the employer space too much.
Can I add one more thing?
Always.
Just one more thing. I do not want to minimize the civic side of addressing social determinants of health. Employers are involved in political action. They have PACs. I think it's important that when we really want to address it at the systemic and structural level, that employers be the voice and use their power for good in that space.
Well, and I also would add to that, including employees in the civic engagement, right?
That part.
If you're going to be talking to JTA about bus routes, then your employees need to know that they also need to be talking to JTA about bus routes that they should be contacting their city councilman about bus routes, right? And we're all working toward making sure that we address the transportation need that is in our organization. Again, that's going to build engagement with your employees and address a very particular need that they have. So I think the civic engagement part is really important and doesn't just address civic engagement, but also addresses employee retention, employee engagement, and employee education. All right. This has been, I could just go on for so long, this conversation. But this has really been so enlightening. Thank you, ladies, for sharing your knowledge and wisdom today. I really appreciate having you all in the conference room.
Thank you.
All right. And thank you for joining us for the Business of Race podcast. We look forward to seeing you next week in the conference room.